Welcome back to today's episode of Unapologetic Living. I am Elizabeth Elliott and I am your hostess, and I am super excited to have Peter Swanz on the show today. Welcome, Peter.
Hi, Elizabeth. Thanks for having me.
Peter is a naturopathic physician located here in Louisville, Kentucky, and his practice is called Vital Force Naturopathy. Is that correct?
That's correct.
And I know I was drawn to just a more holistic realm years ago. I mean, it goes back way back when my mother was diagnosed with breast cancer. I was 11. And I know she felt a lot was tied to like lifestyle at that time. And she sort of revamped our diet and we started doing some different things. She found this tiny little juice bar called Dandy Life in Linden. I don't know if you,
I never heard of it.
okay, are you from here?
I grew up in New Albany, so just across the river.
Okay, yeah. So this was a little Dutch woman, and she had this little juice bar with lots of raw foods and different supplements and vitamins and health pamphlets and so forth. And anyway, my mom found her way there, and things just shifted for us. And I just felt like back then something, and then watching her go through the chemotherapy and helping her brush her hair out, literally pull it out, I just thought there's got to be another way.
Yeah,
And I thought there was a lot more to it than just, something that was happening physically in her body, that there was a lot of emotional stress in our household and familial stress, which definitely I thought had to play a role in, one's overall health.
absolutely.
So, what brought you into this field of work, this line?
Yeah. Thanks for asking. I'll try to make this kind of a shortest answer, but it really unfolded for me over a period of years. I did my undergrad at Transylvania University in Lexington, Kentucky. It's a small liberal arts college. It's, very competitive. It's a great school. And I was a biology major, a philosophy minor, and I was pre-med. And this was, the late 90s. And at that time is when we switched over to HMO and PPO insurance plans here in the US. And so I'm a pre-med student with other pre-med students. And, we're in this liberal arts college. We're getting a very kind of broad exposure. We're being taught how to think. And so we were having discussions about the insurance model and kind of what direction medicine was going in. And there were conversations like, hey, you may not get to really, pick your doctor, and, appointments are going to be even shorter than what they have been. And it was discouraging for me to hear that, because growing up in Southern Indiana, I'm still friends with our family doctor who, would swing by our house if necessary when we were kids, and we could stop by his house. And there was a really special kind of relationship there, and it was a healing relationship. And, based on what I was hearing about the direction with insurance companies, coupling that with my fellow pre-med classmates who, were all very intelligent people, but many of them I felt like would make better scientists and researchers than healers. It was very hard to have a human conversation with them about their weekend. It was just organic chemistry, physics, study, study, study. And it made me start. I think probably the philosophy classes I was taking too, impacted this. It made me start asking, like, what's going on with medicine, and who do you have to be a healer, and would I really want to talk to most of these people about my most serious and intimate health concerns? And I didn't feel like I would at that time. In the same time, so in the I think it was like 97 maybe, or 96, they opened the osteopathic medical school in Pikeville. We have a DO school in Kentucky. UK and U of L are both allopathic medical schools. when the Pikeville school opened, we started talking about it. And I was like, oh, wow, I didn't know there were other types of doctors. I didn't know there were other types of physicians. And, we talked a little bit about osteopathic and, it's bone health. So they have some, manual manipulation stuff similar to like chiropractic. Although I think in most of the schools today, those are like electives, it's not part of the curriculum. But it seemed like it was something different. And as I started doing research, it talked about, more holistic approaches to health. And that resonated with me. And I felt like that was the direction I was going to go. I did AmeriCorps after graduating. I met my daughter's mom as I was finishing up my last year, and I didn't want to go right into medical school. So I did an AmeriCorps placement in Kentucky, and I was working with the Homeless and Housing Coalition of Kentucky, effectively as a case manager for young single moms who were like my age, helping get them on, food stamps and into supported housing. And at the, it was a volunteer position with a living stipend. So I took an evening and weekend job at a Rainbow Blossom. And I thought it would be cool just to work in this little health food store. I wasn't really super into this stuff necessarily. My parents weren't hippies, but I thought seems like a chill place to work. And I would hang out in the store when nobody was around, and I would read the magazines that were there. And I started reading about food sensitivities and, behavioral stuff in children. At the same time during the day, I'm working with these moms, taking them shopping with their food stamps, taking them to the pharmacy to pick up their, prescription for the kid who's got the green snot falling out of their nose. And then we'd go in the grocery store and the kid's bouncing off the wall and the mom's telling me, I don't know why he's not getting better. And I'm like, wait a second, I'm reading about food sensitivities and I'm reading about nutrition, and you're using these food stamps to buy bologna and Kool-Aid and Doritos and soft drinks. And I was like, obvious. I mean, it seemed obvious to me, but like nobody else was talking about it. And the doctors that was dropping these moms off and picking them up, they weren't telling them to feed their kids better. They were just writing them another prescription for an antibiotic and another prescription for an antibiotic. And I had this vision. I just remember it vividly in the store, this kid like bouncing off between the frozen aisles. And I was like, this kid is absolutely going to be diagnosed with ADD, ADHD. He's going to be put on meds when he's young. He's going to hate school. He's going to drop out of school. He's probably going to get a young girl pregnant, and this cycle's going to repeat, and it's going to repeat. And this is our tax money. And we're not actually helping these people in a way that's meaningful. So who do you have to be to break this cycle? And I'll tell you the one other thing, at the place where I was positioned through the AmeriCorps, there was a nutritionist on staff. And the nutritionist there was not telling me to tell these parents what they should be feeding their kids. So like nobody knew what was really going on. And this was a cycle that was going to repeat itself. So as a philosophy, minor and someone who thinks the why is probably more important than the what, I was asking myself, what do we have to do? And I swear to you, within 2 weeks, a new magazine came in, Rainbow Blossom. There was nobody in the store. I'm flipping through it. And there was an article comparing the 3 naturopathic medical schools in the US and talking about being a naturopathic physician. And it talked about spending an hour with your patients for their initial intake and talking with them about their lifestyle and how these things are contributing to their health concerns and how taking a holistic approach is necessary to heal. And I read that article and immediately was like, that's the kind of doctor I'm supposed to be. It was no thought involved. It was a pure gut response. And it's one of the best choices I've ever made.
Now, I know there is a difference between, I want to ask you where you went to school, but there is a difference between a naturopathic physician and a natural.
Yes. Yeah, I mean, yes, there is. A naturopathic physician really should, I mean, so naturopathic physicians, we are not licensed in all 50 states. And a lot of people don't realize that states individually license physicians, right? Like so you have to be individually licensed. So in a state like Kentucky or Indiana, where naturopaths aren't licensed, anybody can call themselves a naturopath. And there's mail order programs where people, pay money and do some online courses, and then they're given an online naturopathic degree, and they can call themselves a naturopath. They're not. I mean, it's not at all. Naturopathic training was actually, I mean, it's an old profession, and it was born from the homeopathic training in the nature cure movement. And nature cure was, like John Harvey Kellogg's, who was into like the colonics and hydrotherapy and fasting. It's kind of some more of these like different lifestyle practices. And then the eclectics were the, like the botanical herbalists who were helping people. And naturopathic medicine came like a fusion of these things. And it was always with people in person, because naturopaths were not licensed. It allowed sort of these loopholes for people to do these programs. We affectionately called them undies, in medical school, as opposed to indies. It's, they're not doctors. They didn't see patients in part of their training. And I think that's one of the biggest kind of deficits in their knowledge and experience. Like there's no training with other practitioners and then actually seeing patients in clinical and medical settings. So my training is, I went to a 4-year medical school. We do basic science, physiology, anatomy. We had to, dissect cadavers. We're trained in pathology. We have to pass basic science boards. And then we go into our last 2 years where we're doing clinical rotations, as well as getting trained in a ton of other modalities. I went to medical school at the Southwest College of Naturopathic Medicine, which is now renamed as Sonoran University of Health Sciences, because they have some nutrition programs and other programs in addition to the naturopathic medical school. But in Arizona, we're licensed to do acupuncture. So I have like almost 1,000 hours of Chinese medicine and acupuncture training. We're trained in physical medicine, so similar to like, chiropractic or osteopathic manipulation, hydrotherapy, Western botanical herbs, orthomolecular supplementation, vitamins, minerals, amino acids, homeopathy. It's a big tool belt. We're trained as primary care physicians. My training includes vaccines. My training includes pharmaceuticals. It includes minor surgery. I am not anti any of these things simply on principle. I think we need to be educated and informed as to the positives and negatives of anything we're considering. And then the individual has the health autonomy to make an educated decision for themselves. I mean, that is what health and medicine should be about.
So now, being considered unlicensed here, or they don't license naturopathic physicians in Kentucky, typically in a state where there's licensure, you could prescribe medication.
Yeah, right, exactly. And so I tell patients here, I say, look, I want to be part of your health team. Even though I'm trained as a primary care physician, I'm not going to fill that role for you or your patients. You need to have a primary care. If you want to come off prescription medications, there's things we can do to start moving you in that direction. But the doctor who prescribed those, that's who you're going to have the conversations with about decreasing your blood pressure medication, or coming off your cholesterol medication, or coming off your antidepressant. And I help my patients to have those conversations. We talk about this. I educate them through the process, and I make them, if they want to get off their blood pressure medication, start tracking their blood pressure. We have to be able to show that it's going down. And hey, that way, when they go to see their primary care, they're like, hey, doc, look, I've lost 15 pounds. I'm sleeping better. My energy's better. I've been tracking my blood pressure. These are what the numbers been. How do I, start to come off these meds? The reason why it's important to track and have that data is because, heading to the doctor, you might be running late. There might be traffic. You might have some snow on the ground. You get in there, you're waiting, you're anxious, and you go into the appointment and your blood pressure's high. And the doctor's like, hey, sorry, we can't take you off. Right. But when you've got that journal or that little blood pressure log, now you have information plus what they can visually see. Oh, wow, you have lost 15 pounds and you do look better. Like, yeah, we'll start talking about how to get you off the med. Most conventional doctors will help patients do this. The problem is their tool belt is pretty much limited to pharmaceuticals. And so I think, genuinely practitioners want to help people, and they can only help with the tools they have at their disposal, right? So it's if all I've got's a hammer, everyone's a nail type thing. But a lot of people today, I think, are starting to realize and wake up to the fact prescription medications do not make us healthier. There is not one prescription medication that actually makes us a healthier individual. Our conventional medical system is not a healthcare system, it's a disease management system. And the goal is to manage symptoms with as many pharmaceuticals for as long as they can to make as much money as they can. It does not incentivize people being healthy. And that's really unfortunate. And that's why, as individuals, we need to be willing to take charge of our own healthcare if we want to be healthy.
And not to make assumptions, my guess is going to be that, and not in all cases, individuals find you because they are not seeing results.
Yeah, yes, they've not seen results. They tried other things. They've been shopping around. I mean, the studies are clear in the journals. The more prescription meds we take, the less healthy we are. So if you're looking at three people and one's on 10 meds, one's on 5, and one's on 0, the person on 10 is the least healthy and the person on 0's the most healthy of that group every time. And so I think people start to realize in their own journey, they get prescribed one med and then 2 and then 3, and they keep going back to the doctor and they're not feeling better. And they're expressing this, and the doctor's saying, hey, but look, your numbers are kind of better, and we've made some improvements here. I'll give you another one and another prescription. And people get fed up with it because their quality of life is not improved. How they feel has not improved, right? And that's why we have to pull back and look at our health in this health picture holistically. The conventional model's reductionistic. We get stuck on a lab value, on a diagnosis. And this is problematic, again, because it doesn't include the big picture. But the other thing it does is it's created this kind of thought process for people today that there should be a thing wrong in like one thing. And so they're like, a lot of people too will come to me because they've gone to the doctors and the specialists and they've run all the blood work. They've done a ton of tests. I mean, spent thousands and thousands of dollars in the medical system, and they don't have a diagnosis, right? They don't fit in any box. They don't have an autoimmune marker that's elevated. They just can't be put in a box. And so in conventional medicine, they're kind of like, well, I don't know what to do. You don't fit in any of these pathologies that we typically define. And so I don't know what the standard of care prescription is. And these patients will call me and they will often say, I want to know if you can help me figure out what's going on. And my response is always, do you want to try to figure out what's going on, or do you want to feel better? Because if you want to just be able to point to one thing, that's not what I do. And it doesn't matter to me. We don't need to find one thing. But if you want to get healthier, we're going to pull back and look at the whole picture. We're going to start looking at your life holistically. We're going to evaluate your lifestyle. What are you doing with nutrition and exercise and stress management and sleep habits and, your community of support? And then we're going to consider what we can do on the other side of the holistic healing coin, complementary and alternative medicine. What does your body need foundationally so it can heal and function the way it's supposed to? And when we start making changes in the lifestyle and give the body what it needs foundationally, healing is the result. The body wants to heal. It wants to be in balance. So we just have to give it little nudges and support to be there.
So you mentioned homeopathy. You mentioned hydrotherapy. Did you say colon therapy? Did you say colon therapy? Is that
colon therapy would be a type of hydrotherapy, but I mean,
okay?
we were trained. We did colonics in med school, and talked about coffee enemas and all kinds of fun different water applications.
Okay, so since you mentioned it, I am curious about coffee enemas. It seems like there is, I don't want to say a craze, but in my algorithm on social media, there are more and more individuals integrating coffee enemas. What do you think about those, and why might one implement a coffee
I
enema?
mean, People do them for liver reasons and for, energy stuff to kind of clear things out. I don't typically prescribe coffee enemas to patients. I don't typically prescribe enemas to patients or colonics. I'm trying to get people just to poop normally on their own without having to
Yeah.
kind of
Well, I
do
mean,
those more invasive stuff. But again, some people really enjoy it. For us in med school, we were more likely like, oh, I'll do a coffee enema like at the end of a detox or something, kind of put a bow on that process or that experience we were doing for ourselves. So like there's times like that, but I tend to try to do less invasive stuff with my patients. Um, Often to be healthy today, most people don't need more things. They don't need to take more things or do more things. They need to stop doing the stuff that's not working for them. We need to start cutting stuff out of our life more than we need to start throwing more things at it. And again, the reason we think we need to throw more things at it is the conventional medical system. That is the approach.
yeah, that also throwing more things at it seems easier than,
Right.
yeah.
Yeah. Change is always difficult, right? It's always, I mean, it's hard to break free from that inertia all the time. And so, but once we start to do it and then we start to experience the benefits, we're effectively cultivating new habits. And once something becomes a habit, then it's not as difficult anymore, right? Like most of us don't think about flossing and brushing our teeth at all. It's just we do it, right? Cooking and eating eggs and some veggies warm for breakfast. Like once you just do it every morning, I don't think about it. I just know that's what I'm doing for breakfast.
So homeopathy, talk to me a
Mm-hmm.
little bit about that because I know that was one of the first modalities I started implementing with my own children over 20 years ago. And it was very new to me. I would not be great at articulating the way it works in the body. I have
Mm-hmm.
a profound belief in it. I saw it work on my kids.
Mm-hmm.
I don't, I have what is it, the Osco.
Ciliococcinum.
Yes, thank you. Yeah, I
Yeah.
keep that around.
Yeah.
But I find, and definitely something that I would turn to. Still, I don't know if it's a good thing or a bad thing that I haven't felt like I've needed to reach for that. Although, I know that it can have benefits in a lot of ways for a lot of different things, even emotionally and mentally.
Yeah. Yeah, so I love homeopathy. I'm a fellow of the Homeopathic Association of Naturopathic Physicians, and I have a really big tool belt that I can help people with. Lots of complementary alternative modalities, the lifestyle supports. But if I had to pick only one tool, I would pick classical homeopathy. I feel like that's my skill set. If the zombie apocalypse ever comes, this is what I'm gonna primarily be able to bring to the table. Homeopathy, it is misused. The term is misused often. It is used synonymously to mean alternative medicine or naturopathic medicine. I went to a 4-year naturopathic medical school. For the first 2 years, I would call home and I would talk to my mom, and she would say, I told so and so you're in homeopathic medical school. And I'd be like, Mom, it's naturopathic. It's naturopathic, right? It's just the word gets misused. I've had patients tell me, oh, yeah, I tried homeopathy. I took echinacea when I had a cold. That's a botanical medicine, right? It's not homeopathy. So, homeopathy, homeo meaning like, pathology, like pathology. So we use substances in very, very diluted preparations and we prescribe them for the whole symptom picture of the individual. And we're looking for a remedy that has caused similar symptoms in the individual that is in front of us to match it up. So I like to use an example that's kind of easy for people to wrap their head around is Allium cepa, which is the botanical name for an onion. And so Allium cepa is a homeopathic remedy made out of onion, and it can be a good one to use acutely for like hay fever in the spring, right? What's unique about it, if you imagine and think about cutting an onion, it's that kind of burning in your eyes and the nose, and everything's watery and kind of flushing out. But what do we do when we're chopping an onion in the kitchen and we start experiencing that? We get out of the kitchen, we step outside, and we get some fresh air. So allium cepa is good for hay fever. That's actually, the individuals have a worse time when they're indoors and they feel better when they go outdoors, right? And that's weird because that's not typical for most people's hay fever, right? They're worse when they go outside. They feel a little better when they come inside. So somebody that has that little aspect flip-flopped and's got the watery, runny, burny stuff going on, you give them allium cepa and it helps the body to come back into balance and then, feel and function better.
Yeah, that is the one that always comes to mind. I think that's the same example that the homeopath I used years ago used because it's something
Yeah,
that's very relatable. I was just cutting onions the other day and I was
that's
uh
right.
go ahead.
And with homeopathy, what you're looking for, again, the beautiful thing with homeopathy, but what also makes it more difficult in chronic situations, is you're not prescribing because of a diagnosis or because of a lab value, right? It's for the whole person. And then what you want to look at is what are the things that are peculiar and particular to the individual. So again, like with the hay fever, oh wow, it's pretty peculiar that it's better when you go outside, right? That's what sort of differentiates it. When we look at the chronic stuff, it takes a lot more work. And homeopathy is very much an art. And it's a challenging practice to do for more chronic stuff and constitutional stuff, right? But the medicines are so incredibly safe that it's a fantastic support to use at home for families, for individuals, for acute stuff, for like first aid stuff, for, colds, right? Because, when you get a cold, we don't have to consider as much your emotional state, what's going on with your poops, unless there's something significant going on. What we really want to know is, hey, how does your cold manifest? Is it more congestion? Are you sneezing? Is it post-nasal drip? Do you have a sore throat? Right? And 10 different people that have a cold could have 10 totally different symptom pictures and hence need, 10 different remedies to get better from that.
So in a sense it's like cures like.
That is exactly what it means. But again, we're saying like based on the symptom picture that has been caused. Because, people can, like, there's a remedy called Rus toxidendrum. It's made from poison ivy, right? And it can be indicated for poison ivy on the skin, but it's not always indicated. Sometimes people that have poison ivy would do better with sulfur or urticaria or apis, right? Some of these other remedies. If somebody says, "Oh wow, you have poison ivy, you should take a dose of Rus tox," that's not homeopathy. That's isopathy. We're using the same substance to treat something caused by that substance.
So you would be looking at additional things going on in the body when they present with poison ivy.
Yeah, and what it's called or is the term is the modalities. So when is it worse? When is it better? Right? Does it feel better, in a hot shower, or does the hot on it make it feel worse? Right? Like those things. And some people will say, "Oh my God, I have poison ivy. I want to scald it under hot water." If that's the case, Rus tox probably will help because Rus tox is better from a hot shower, where something like sulfur typically then feels worse after a hot shower.
So during COVID, I bought a homeopathy kit. I'm
Awesome.
going to say there's like 40 remedies in there. And I
Yes.
probably it's so to me, homeopathy treating it from home is a little bit intimidating simply because of all of those things that you just mentioned that it isn't. I mean, I know I've pulled the Rust Tox out for poison ivy. I don't know that it worked or not. And because of the fact that I wasn't considering every one of those things, even though I have some good books around it. I do think it's a little bit more challenging to uh, get that correct remedy, maybe, than
Hmm.
I don't know. Not that I'm, I have no physician's training or, I've just pulled in what seems to make sense, which has always seemed to work well enough over the years, which are typically either herbs or something I've picked up at Rainbow Blossom, or essential oils and different vitamins and
Yeah.
minerals. And obviously, pulling out the traditionals like bone broth and getting rid of, the sugars. And I mean, it's not we don't have a lot of that in our home anyway, but
Yeah. Clean it up a little more when you're fighting an infection or dealing, yeah, sick for
yeah.
sure. I
Um,
mean, for me, let me just say, in practice, I can't, I've had a few patients who only wanted to do homeopathy. And so that's why they came to me. Most of the patients that come to see me have no idea what homeopathy is. It's just one of the things that I'm using with them. And my hope is that they start to experience it. And again, most of the patients that I'm working with, it's for more chronic stuff. It's not for acute stuff. But while we're working together, what I tell them for themselves or their family, if it's a mom, hey, if anything comes up for you or for the kids, I want you to reach out and we're going to talk about what you could potentially use acutely to support yourself or the children at home. And it will include whatever acute homeopathic remedy, I think fits, but also doing some vitamins and immune supports and other herbal things, right? Hydrotherapy, warming wet socks is phenomenal for any upper respiratory type infection. I've got a YouTube video about that. So like that's a brilliant thing. But what's really cool, Elizabeth, is that once once we sort of get a feel for a remedy that does help an individual in this acute situation, there's a good chance the next time they get another cold that they're going to benefit from the same remedy because it's the constitution, it's our unique constitution. It's like, oh yeah, every time I get a cold, mine becomes postnasal drip and then a sore throat and then it goes into my lungs, right? So boom, once you know what remedies can help and you've got those immune protocols, it's a game changer. And now you don't have to go get all the over the counter, decongestants, cough suppressants, Tylenol's horrible for most people. Like, we can avoid that stuff.
all right, okay, in talking about respiratory issues, as we're you know,
The
heading out.
flu's been crazy. Well, yeah, the flu and upper respiratory stuff's been crazy lately.
It has been crazy, and some of this stuff seems to have been sticking around considerably longer. Now, I am wondering I'm curious. I was reading something on Twitter, I don't know, yesterday. And it was a Substack article talking about how, and I don't know, maybe you have thoughts on this or insights around it on the immune system since the vaccines or even COVID. I don't want to get too controversial, but I know that, Alex Berenson was just writing an article about how people who've had the vaccines are actually sicker. It has definitely suppressed their immune system, and they're seeing, more of this. And so I can't help but wonder personally with
Mm-hmm.
the individuals, who I see regularly, many of them who are vaccinated, who have been uh, sick more often than they seem to feel like they ever have been before.
Yeah, I mean that's always been true with the flu vaccine. It's a poorly matched vaccine. In its most effective years, it's like 50% matched to the flu strains that are going around. And then the data is clear, especially in like elderly people who have had the flu vaccine for multiple years and then get the flu, they have a worse outcome than people who have not gotten the flu vaccine. I mean, the way I think about it is, we tend to, one of the ways they look at efficacy with these vaccines, with these types of shots, is by saying, hey, we give you this and then your antibody titers go up. Like your immune system reacts to this thing we're injecting you with, which it should. But to look at it and say, oh, because your antibodies went up, that's a good thing. That's a jump to go there. We don't necessarily know that. And, with the mRNA technologies and in particular with the COVID stuff, right? Like, that was what they were doing. And they were saying, oh, whoa, 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 antibodies have gone down. We need to do a booster, what, right? Every 6 months or whatever that might have been. I mean, in every other scenario with the person who's having antibody spikes, we're like, this is bad. You have an autoimmune disease, right? Like your immune system is overreacting to things it shouldn't be reacting to. Um, but even before the mRNA stuff and the COVID stuff, there's always been people who just keep getting sick or can't seem to get over, the cold or they have the cough that's lingering. And in a lot of those cases, what we're talking about isn't actually an acute illness, right? There's an underlying chronic problem. There's a chronic deficiency. There's a chronic imbalance in the way that individual it's expressing outwardly is through an upper respiratory infection, right? But it's not truly acute. There's a chronic issue for susceptibility. And so, like with those patients, I'm like, hey, one, you're not dealing with an acute upper respiratory infections every 6 weeks. You have a chronic issue, and that is how your body is letting you know there's things not working. We're going to address the underlying issues, and we're going to also talk about strategies for more quickly getting over the acute stuff so that your body can return back to health and balance.
Okay. So and also in talking about, and this popped up in my feed today, which I haven't had a chance to listen to or read. Uh, Daniel Royatis, I believe is his name. Are you familiar with him?
I
He
don't.
authored the book, Can You Catch a Cold? What are your thoughts
Oh,
on that one? Because I know, there's some new, I'm beginning to wonder if one can truly catch a cold. And if it has more to do with like, I don't necessarily know that I can pass it to you or you could pass it to me. And how much of that goes back to terrain.
absolutely. It's all about susceptibility. I mean, because we're exposed to viruses and bacteria every day, like all the time. Like it's crazy to think we wouldn't be. And it's not what we're exposed to, but what we're susceptible to when we're exposed. I tell patients, I neti pot most days when I shower. Like it's easy to neti pot in the shower. You don't have to lean awkwardly over the sink or tub. It's just kind of part of my normal shower routine. And the first time I had, I don't know, we can say caught or acquired or developed or tested positive for COVID was a period back in the fall of 2020. And it was a busy week. I had a ton of stuff going on. It was stressful, and I didn't neti pot for like 4 days. And that was the first time I had COVID. And I absolutely contribute that to a factor because I do stand up comedy as a hobby and occasionally for money. And I had performed with two different times with comics who tested positive for COVID right after we performed, and we were sharing microphones. As close to our face as you could possibly be. And in neither of those scenarios did I develop COVID. I was not as stressed. I was using my neti pot still consistently, and then it was this one week, and I actually think I know. I actually think it was a patient who I got exposed to. But I treated her with homeopathy and she got better really quick. And then she never did a COVID test and she denied that she had COVID. And I asked her to get her antibodies tested and she did, and they were positive. So I think that's where I got it, or exposed to it anyway.
Yeah, I know I'm golly, I had the COVID one time, and I've never tested for COVID. I did get the
Good
antibodies.
for you. Yeah.
Um, and um and they were positive. So I did do that piece. I was just curious because we were down, but it was such an unusual set of symptoms. When I did have it, it was January 2021 and treated it completely naturally with, like I said, all the things I mentioned. It could be a hodgepodge of things. um,
Yep.
of, of vitamins and minerals. I don't know if I was using any homeopathy at the time, but I did a lot of infrared sauna. Uh,
Nice.
so now stress, and I know stress can be a big contributor to dis-ease in the body. I know that when I think it was 2020, it was summer 2020, my daughter, well, her father was going out of town and for about 10 to 12 days and to the Boundary Waters, and he was going to be
Love it.
canoeing. And anyway, at that particular time, he wasn't in the best of health. High blood
Mm.
pressure medication. He was heavily drinking. Now he's sober 4.5 years almost, and things are, but at that time, I had created such a sense of stress in her. We're thinking, oh my,
Right.
right? Just talking, knowing that he wasn't in the best health and knowing he wasn't going to have any phone access. Like I could go to these catastrophic places with anxiety. And uh and she came down with shingles.
Mm.
Now,
Had
mind
she,
you, what?
she had did she get vaccinated for
No,
chickenpox? No, good.
no. But that homeopath that I was sharing with you earlier, when my kids were, well, my son was 3.5 and my daughter was about 5 months, chickenpox came through
Hmm.
the community, and we went to a chickenpox party where they shared suckers and spoons and ate ice cream, and I knew what I was walking into, but Alice really helped me prepare for that. And
Yeah.
she had mentioned, and I was still nursing my youngest at the time, so she was like 5 months, and I was a little bit nervous about taking them both, knowing that Maddie might get the chickenpox too, and she got like maybe 4 or 5 spots.
Mm.
But Alice said, she would have my antibodies from my childhood, exposure to chickenpox, and I was nursing, and that would benefit her. She also told me if the case wasn't strong enough, she might get it again.
Hmm.
But she didn't. I think it ended up manifesting. It must have been enough of a case that it manifested as shingles later. I mean, I don't know what you think about that, but
How old was she? How old was she when the shingles came on?
she was, what was 2020? She was 15.
Yeah.
Now, let me
Yeah.
tell you something about
Okay.
this. She had shingles in August of 2020, and it was a chiropractor who helped me figure it out because no one thought that she could have shingles, actually. And let's see, April of 2021, she was bitten by a tick and diagnosed with Lyme right away. Now, I don't know if they're connected. I don't know if because her immune system was already maybe compromised from the shingles, because I'm not even sure, like even with a tick bite, just because you get a tick bite, there are so many ticks out there, and with as prevalent as they say Lyme is today, which I think it's far more underdiagnosed than diagnosed. I do, wonder if there are people who could almost build up even an immunity to Lyme with tiny little tick bites throughout their lives over and over and over again. Because you have people, like I have a friend who lives in Goshen and hikes every single day and has been bitten by little ticks and seed ticks and all, and never contracted Lyme or shown symptoms or labs that would indicate Lyme. Like, does it maybe even work in a similar fashion if you are slowly exposed to something repeatedly, just like with a homeopathy, that tiny dilution of something?
It's see, but that's not what homeopathy does. Homeopathy is not prophylactic like that as a
Okay.
protection thing, and I
Mhm.
would not advise anybody to intentionally get bit by ticks.
Obviously, no. I mean,
Yeah,
Lyme sucks.
Lime's brutal. Yeah,
It is. My daughter has
Lime's
it.
brutal. And my recommendation is if somebody catches a bite and has any kind of rash reaction to it, treat it with antibiotics. It should be treated at least 2 weeks with cephalosporins. Pretty heavy duty Keflex something because it's bad. And if it becomes chronic, it's way harder to treat chronic than it is to cut it off acutely. As far as with the shingles from, yeah, I mean, definitely, a 6 month old does not have a fully developed immune system at all. Like, you're not going to, I mean, often, if you think about it, like young infants don't really get sick with a lot of different stuff. It's kind of like RSV. There's a few little things, but like they don't tend to, you don't diagnose a baby with strep throat and these other types of infections. And that's partially because they don't have a fully developed immune system. And the things the way we diagnose are the symptoms. The symptoms is the outward expression, again, of whatever the underlying imbalance infection is. It, I would imagine though, there is thoughts about shedding, right, with some vaccines. And I could imagine your daughter, most of her, friends or classmates and people probably were vaccinated for chickenpox. It's a varicella vaccine. It's in the same families as like the herpes simplex viruses too, which a lot of people carry, and so that kind of sets, people up and to be more susceptible. So it's definitely a weird thing. Hopefully she never gets it again, which can happen. I had a buddy who got shingles like one time in med school at a particularly stressed time. And it was weird because, we all had chickenpox when we were kids and didn't do the vaccines. And I didn't have my kids do the chickenpox vaccines, and we did the whole chickenpox party too. And it was great.
Yeah, I know. I remember coming home from preschool with the chicken pox, and my mother dragged me down the street to I don't know, some other mom with an older child. What's this? Like, tell me what this is. And then the oatmeal baths and what,
Right.
I mean, it wasn't, and I probably got, extra ice cream back then because they're like, and ginger ale and with high fructose corn syrup and the saltines and whatever else you would traditionally, well, that's what we grew up on when we were sick. It was saltine crackers, Estes,
That's right.
ginger ale, and Campbell's soup.
Exactly.
And I'm alive.
Yeah.
Those wouldn't be the choices I make today or the ones I made for
But the,
kids.
the yeah, but the mother's love and concern goes a long way. Hugs for mom and sympathy for mom helps for sure. That's always healing.
Yeah. So, and you work with, so you mentioned family. So you usually you see all ages and stages.
Yeah, I do. I love working with kids. I get a lot of skin stuff with kids, behavioral stuff. Parents are looking for alternatives. It's a challenge, and I'm very frank with parents. I tell them, I'm like, look, if you want to work with me, we're going to be looking at this holistically, and you need to make changes at home for things that aren't working. You've got to be willing to look at the food stuff and make changes, and we can figure out what will work more optimally, but you've got to be willing to make changes. And typically when somebody like even when an adult, in a family, a mom or a dad comes to see me, I tell them, I encourage them to bring the other adult in the house, because I say, hey, this is going to impact everybody. We're not just going to be supporting you. You're going to be changing your lifestyle. And like, I had a woman who I was helping with migraines, and she and her husband were nervous about the dietary stuff. And, 4 months later, she's doing great. She's not having headaches at all. And I asked her, I said, hey, how's your husband doing with all the changes? And she was like, oh, he's fine. He's lost 20 pounds. Right. Like, that was a collateral benefit of the changes they made to address her migraines, but they looked at the picture holistically. They cut out food sensitivities. They started eating for stable blood sugars and insulin levels, and everything changes.
Yeah. And I know almost food sensitivities. I've talked about in other episodes, that's different than a true allergy.
It's a different immune reaction, right? What we consider allergies are IgE immune reactions in the body. This is the eosinophils and mast cells, and it's a histamine release. And, that's what we call allergies, and allergists love them because they can prescribe antihistamines, right, to block the symptom of the underlying exposure. What we talk about sensitivities, we're talking about an IgG or an IgA immune reaction. There's no histamine involved. There's no acute red, itchy, Sometimes though the body's immune reaction and that stress it causes, it may not react for, 12, 24, 36 hours later after the exposure. But all of the things we get exposed to that are triggering immune responses, that are stressing the body, they're all sort of coalescing together. It's like we have to imagine our body like a vessel, and we can only hold so much. And so the reason foods and food sensitivities are important, and why they sometimes seem like they're a bigger than normal piece of the puzzle, is because we control 100% what we put in our mouth and what we eat. And so that is a place where we can absolutely impact our health. We can't change the pollen count or the mold count outside, or who we get exposed to, with other illnesses or work stress or emotional stress or the stress on the news, or, all these other things. And believe me, the emotional, mental stress impacts our physical body just like the food stress or the environmental stresses.
So I have a question. When it comes to changes, are you curious, excited about some of the changes that I sure hope uh, RFK Jr. can make around, you
Absolutely.
know, yeah.
Yeah, absolutely. I could not be more optimistic right now for the direction that healthcare can go, because, we are the least healthy industrialized nation in the world, and we're spending twice as much money as the next countries behind us. It's horrible. I mean, we spend $11,000 per person on healthcare every year. And, I talk to patients about it, and it's like, well, I'm not actually spending $11,000. It's not coming out of my pocket. And I tell them, I'm like, yes it is. That's your tax money. These are your benefits, and it's just being thrown at the wrong things. And RFK Jr. has been, talking about healthcare and the children's health, chronic disease epidemic for a long time. He is not an anti-vaxxer. Anybody that's actually ever listened to him speak, he has never said he is against vaccines across the board. And this is what I say. My training includes vaccines. I am not an anti-vaxxer. I did vaccinate my children with some of the vaccines. I did do it on a delayed schedule. I did also make sure that their immune systems were strong and robust and they were healthy when they got them. That's what I chose and did for my family. That's what was right for me. Every individual should be able to choose what they want to do. All of the chronic diseases that we're worried about kids getting, they were all declining before we even invented and started using vaccines. And one of the biggest factors there was the improved sanitation, cleaner water, better food storage. That's what really made a big difference as far as chronic acute diseases. Things like measles, mumps, rubella, these are viral illnesses. There's a ton of things we can do to help the body fight these off. They're almost never fatal. And as we pull back and actually give the fair evaluation of the vaccine schedule and the number of vaccines we're exposing people to, I think it's going to be sad, because I don't think we're going to be able to deny and play around with cancel culture words like anti-vaxxer anymore, because people are, it's been used to silence parents who were concerned for their children's health, by people who were fortunate that their kids weren't harmed by these interventions that they maybe didn't need. And it's just such a really kind of gross way to treat fellow humans that are suffering. And I've had enough patients and parents in my office to say, Dr. Swanz, my child seemed fine until this happened. And who am I to deny their experience, right?
Hmm.
I just want to help them feel better, help the kids get better. And the beautiful thing is, there's a lot of things we can do to work with kids on the spectrum, and anything, any sort of chronic illness. We can always start getting healthier.
Yeah, I know that, I definitely think it's important that people get to make that informed decision and decide for themselves. I know being a young mom at the time, I did not feel I was given that information
Right.
on both sides of the coin. It was, if you don't, we won't see you. You can't go to childcare or school. Worst case scenario stuff. And, in time, I found out otherwise.
That's right. Yeah, yeah. It's. I mean, our health is our greatest asset, and it's the thing that we need, the most to carry us through life, and to have other people dictating what we should be doing for our health. It's ludicrous. I mean, it's such a ridiculous thing that anybody would ever think that's appropriate or kind or considerate. And I am all about the collective well-being, but I believe health, it's an individual's responsibility to pursue health for themselves. And I believe health is more contagious than disease. And when we start making changes that transform our health, we become an inspiration and a motivator for the people around us. The best thing a mom can do is take care of herself, prioritize self care, not think it's selfish, and model that for her children. So many of the moms that come into my practice, right, they've been sacrificial of their health, taking care of their partner and their children, and often neglecting their own well being. And then, they're in their 50s and trying to, get better. And again, I appreciate it. My mom was like this. I appreciate a mom's love and selflessness, and that's why we have to change this idea that self-care is selfish. And we want to model it, because children are going to do what they see us doing, and we can do better than we have been.
Absolutely. And, I mean, I guess and to those parents who maybe have not experienced a vaccine injury, I also would question, asthma and chronic allergies
All
and
of it.
repeated strep throat infections, and whether or not it may not be something like having a child diagnosed on the autistic spectrum that would indicate, yeah, vaccine, um, you know, issues.
Damage. Right,
Yeah.
right, right. Yeah.
But so yeah, it does seem like it's almost, again, it's this pitting of two groups, which has been,
Well, the beautiful thing is that, RFK wants to look at the whole picture. He wants to look at it holistically. He's not coming in to just try and point the finger at vaccines. And I don't think he actually, again, is against the vaccines. He just wants the honest information. And people have been lying to us and gaslighting us. It's going to be beautiful, though, too, what happens to the food supply, because so much of what people are eating today is not food. It's processed, packaged garbage that's nutrient void, calorically dense, filled with chemicals and preservatives. And good Lord, if the fuel we're putting into our body is not impacting our health and how we feel, what is? And people, I mean, I've had patients, it'll often be a mom who will say, well, my mom says if it was bad for you, they wouldn't sell it. And we're like, wrong again. Like, I'm sorry that you think that. That is a very idealistic way to imagine, these corporate psychopaths that prioritize profits over everything else.
yeah.
So
I know for me with my kids, they know they don't always make those choices. And I'll try to remind them with letting them know that they can't put sand in their car.
right, right. It matters.
It matters.
I've had patients with GI issues come in and tell me that their gastroenterologist told them it doesn't matter what you eat. And I'm like, that's like a mechanic saying it doesn't matter what kind of fuel you put in your car. Like, how could your specialty be the digestive system and say the food you're digesting isn't impacting it? It's bananas to me.
Yeah. So I know you have a couple events coming up,
Oh
and
yeah.
you've got one on allergies, right? And then another one I like. I mean, I like them both, but I do see a lot of older folks. Like,
Yeah. Yeah.
and so I know one's on healthy aging, and that's an in-person event. But can you share a little bit about those? And then
Yeah,
all of your
I
info
do.
will be in our show notes for anybody
Perfect.
listening, that you can find him, or you can reach me or him.
Yeah, Vital Force Naturopathy on Facebook and Instagram, and I'm on YouTube, and I post videos and content and articles and motivational stuff. And I do at least one event in my office a month. I maybe take July off sometimes in the summer, just it's not a busy month, but I have also started streaming those so people that can't make it to the office can watch those. And the next one is just under 3 weeks away. It's on Tuesday, March 11th. And that's going to be, it's right after we roll the clocks forward. So we're going to spring forward into allergy season. And I'm just going to be talking about, holistic and alternative ways we can support ourselves heading into the allergy season, some homeopathics and herbs and other things that can be, valuable for acutely treating things when they start to flare up. And then the next Saturday, so that same week, Saturday, March 15th, I'm going to be at a cool little health food store in New Albany, Indiana. It's called Seeds and Greens. It's great. It's been there for, probably getting close to a decade. Stacy, I love the owner, and she has me come in pretty much every winter. We do a like January, February, March series. And so this is going to be the last one of that series that we're going to be talking about healthy aging. And, there's a lot of stuff going there. I'm getting older. We all are. And there's a ton of things we can do again to hedge our bets and support our health and our vitality as we're getting older. We don't have to, just sit around on the TV and on the couch watching TV in pain all day. We can live a vital, vibrant life if we're doing the right things.
Thank you. I look forward to maybe I'll catch one of those. I would love to maybe, well, March 15th, I'll be in a training, but maybe I'll catch the Tuesday, March 11th.
That's
Um,
awesome.
but then you said, okay, so the streaming would be on YouTube.
I've done one on like a webinar kind of platform, and then the most recent one I just did over Zoom. So I'm kind of experimenting to see. It's new for me to be streaming these live presentations, so I'm working on that. But I really do want to build and support a community of more healthy people and people pursuing health, because again, I believe health is more contagious than disease, and we become a culmination, or of the people that we surround ourselves with. And so we should be utilizing these types of technologies in this way.
So in order to hop on that Zoom or the live stream, would the
Mm-hmm.
best way be to sign up for a
I
newsletter?
On Facebook right now.
Okay.
I do have I do have newsletters that I put out some, but I'm more posting content almost daily on social media. So following the Facebook page, I posted the link on Facebook and
Okay.
Instagram last time. So that's where we'll do it. I'm sure this next time
And you also see people,
remotely.
yeah, okay.
Yeah. Yep.
Awesome. Thank you so much for chatting.
Elizabeth, it's been a pleasure.
Yeah, I mean, I had more questions, but I know I don't always ever have time for all the questions. Water was one. I'd love to hear your thoughts on water sometime.
Yeah,
Uh,
let's do this again.
yeah, and I hope you have a fantastic day.
You too. Thank you so much. It was an
Yeah.
absolute pleasure.
Yes, thank you. Have a great
All
day.
right. You
Bye-bye.
too. Bye.